Hi, everyone, and welcome to the webinar Organ Donation in PEI. My name is Megan Dowling, and I am the Program Coordinator with the Kidney Foundation of Canada Atlantic Branch. I'm super excited to be here with all of you today and very pleased to be partnering with Organ and Tissue Donation PEI. So let's get started. Just before I introduce our speaker today, I'm just going to go over a few items so that you know how to participate in today's event. By default, you have all entered into the webinar with your audio muted. We keep everybody's audio muted just to help lower any background noises, which helps us to keep the webinar flowing smoothly. Today's webinar is being recorded, so you will receive a follow-up email within a few days that will have a link for on-demand viewing and a copy of the PowerPoint slides used today. In this email, there will also be a link to an anonymous survey about how today's webinar went. It is just a short survey, and we'll ask that if you do have time to please fill it out and provide your feedback. Your feedback is very important to us, and it allows us to improve our future webinars and to be able to tailor them to what you wish to learn about. Since we are all muted, you will still have the opportunity to submit text questions. There are two ways that you can do this. You can either put them in through the chat box or the question and answer box. If you do submit them through the chat box, your name will appear with the question. So if you wish to submit a question or comment anonymously, please submit them through the question and answer box. And both of those boxes should be at the bottom of your screen there. And you may send in your questions at any time throughout the webinar. We will address them at the end. And if we don't end up getting to all the questions, we will send some answers through a follow-up email as well. There is another way that you can participate in today's webinar, and that's through polls. Angela, our speaker, has prepared a number of questions to ask you all throughout the webinar. All you have to do is participate. To participate is click on the answer that you think is correct or best describes you when it pops up on your screen. So with that said, let's start out with our first poll. All right. So here is your first poll, and it says, which statement best describes you? You can pick, I'm a kidney patient, I am on dialysis, I've had one or more kidney transplants in the past, I am a living kidney donor, I am a family member of someone with kidney disease, I'm a caregiver of someone with kidney disease, or I am not connected to kidney disease. And again, I will say all of these polls are anonymous, so we can't see any names. We can just see the number of people who submitted a question, an answer. All right. I'll end it here, and I'll share the results. All right, so it looks like we have mostly people that are family members of someone with kidney disease, and a few that are not connected to kidney disease. So that's great. We have a little bit of variety today. So I'll just stop sharing those results. All right, so you'll see a couple of those different polls coming up throughout the presentation. If you can, submit an answer, and that's a way that we can interact a little bit. Okay. All right, so now I'm very pleased to introduce Angela Carpenter, the PEI Organ and Tissue Donation and Transplant Program Manager. Angela has been in this role since 2014, and before that she worked in several different areas, but the ones that led her to this position were working in the ICU and in hemodialysis. Angela completed her master's degree in nursing, and her research was on organ donation and PEI, why PEI needs an organ donor program. Angela also has her certification in nephrology nursing, which means she has specialized knowledge in nursing kidney patients. So it's my pleasure to welcome and pass the floor over to Angela.
Okay, everyone should be able to see the first slide. It says
Yes.
organ donation on PEI and my name. Okay. Uh, so thank you, Megan, for inviting me to be part of this. I understand this is part of a series of presentations, so that is great that all this information is out there for people to access. And like Megan said, I had started out working in intensive care and actually cared for an organ donor while I was there, and it just struck me how amazing it all was. Just the work that was involved, but also the feeling of, I don't know, doing something amazing. Like you're saving all of these lives by donating your organs. And speaking to the donor's family, that was how they viewed it for sure. And so it was just really, really amazing thing to be a part of. And then a few years later, I went to work in hemodialysis. And I don't know if people know this or not, but most of the people who are waiting for a transplant are waiting for a kidney transplant. And so that is kind of when I tied the two together, I guess. And I was working on my master's degree while I was working in hemodialysis. And so that was why I had started looking into organ donation and transplant on PEI. And we didn't have a program at that time. And just sort of what was possible on PEI and what we could do here and what we needed to sort of build that program that didn't yet exist. So anyway, a few years passed and this job was posted, and I thought, oh wow, that's exactly what I've been looking for. So anyway, applied, got the job, and I've been in this job ever since, so going on 7 years now. We still don't have a huge program. It's still just me, and I have another job as well that I'm responsible for the blood program on PEI too. So yeah, it hasn't grown as quickly as I would like, but we are slowly but surely achieving things. So thank you all for participating. Since none of you, I guess, have had a transplant, I'm going to assume that you're here more for the donation side than the transplant side, which is great because that's what I'm here to talk about. So when Megan and I first started talking about this, I thought the best thing to do would be to answer some of the most common questions that I'm asked as the manager of the program. So most of the questions that I get asked have to do with the PEI Intent to Donate Registry. It's been around for a few years and I think it's been very successful, but a lot of people don't understand why we made the change and what the benefits are and the pros and cons and that kind of thing. So I'll talk a little bit about the Intent to Donate Registry. I also get a lot of questions about who can be an organ donor, and I did notice that there's already a question in the Q&A box about, can I be a donor if? And I get asked that question a lot. And then just organ donation on PEI. So I've had people ask me if there are any people on PEI who've ever had a transplant, and can people be a donor on PEI? So just sort of how that all works, and then time for some question and answers at the end. So poll question number 1. How many Islanders have received transplants from 2010 to 2019? So those are the last 10 years, basically. We don't have stats for 2020 yet. So your choices are none, 36, 71, or 92. Oh, wow. It's totally even. Okay. So the actual answer is 92. We have had 92 islanders who have received transplants in that 10-year period, which is quite a lot, really, considering our population. Oh, and I am also going to apologize. My email has been going crazy. So I thought it's always nice to put a face to what I'm talking about. So I myself have not really been involved personally with organ donation or transplant. I have worked with donors and their families and transplant recipients, but I myself have not donated anything or had a transplant. So this is Debbie. She is one of the 92 islanders who has received a liver transplant in the last 10 years or so. And she is just so grateful for her transplant. And she is a huge advocate for organ donation. She and her husband traveled to Ottawa, excuse me, a couple of years ago to represent PEI at a Canadian Blood Services ceremony. It was to celebrate the first Green Shirt Day, I think. So the year after the Humboldt Broncos bus crash, when Logan Boulet became an organ donor. Canadian Blood Services had, I think it was a weekend, but it was several different events to honor transplant recipients and donors and donor families. And the picture on the right is probably one of my most favorite organ donor pictures. This is Debbie and her family. So her husband, her children, their spouses, her grandchildren. And to me, it just shows that when you become a donor, yes, you're impacting your transplant recipients, but you also impact so many more people. Like all of these family members have been impacted by organ donation because their mother and grandmother was able to get a transplant. And I don't know if you can read their shirts, but it says my, wife, grandmother, mother is proof that organ donation works. And they had those specially made for their family. And I also like to start out with a graphic just to show what organs and tissues can be donated. So there are other organs and tissues that can be donated for research, but I deal with organs and tissues that are donated for transplant. So the organs that can be donated for transplant are heart, liver, small bowel, pancreas, lungs, stomach, and kidneys. And then the tissues that can be donated are heart valves, islet cells, which are in the pancreas, skin, bones, corneas, tendons, and veins. So all of those can be transplanted into another person. So time for poll question number 2. We're going to start talking about the PEI Intent to Donate Registry next. And I just want to get an idea of how many people you think are on the Intent to Donate Registry. So just to kind of give you a ballpark, the population of PEI is somewhere between 150 and 160,000. And there are about 125,000 people on PEI who are eligible to be on the registry. So do you think the number of people on the registry is 10,000, 30,000, 60,000, or 100,000? So 75% say 60,000, and you are correct. We have just over 60,000 people. I think it's like 60,700 or something, which is almost half. If you say we have about 125, I think it works out to be around 46%. So I think that is hugely successful since the registry has only been around for a few years. We get roughly 2,000 new people added every month. The last year at least, it's been about 2,000 people a month. And the Canadian average is 32%. So we are doing really, really well. And of those 60,000 people, about 70% of those have said yes to organ or tissue donation, and 30% have said no, that they would not want to be a donor. So the Intent to Donate Registry is a place for islanders to record their wish to donate organs and tissues or not. You can say yes or no. You can say yes to one and no to the other, or yes to both or no to both. It actually started in the fall of 2015, so we'll be coming on 6 years this fall. So 60,000 people in 6 years, that's pretty good. And one of the biggest advantages is that it can be accessed by healthcare providers when the opportunity to donate arises. So in the past, you had to actually see the card to know whether someone wanted to be a donor or not, either the driver's license or the health card. And people don't always have their card with them when the opportunity arises. So this way, it's online and healthcare providers can access it. Just excuse me for a second, I have a drink. And the other advantage, big advantage, is that there are multiple ways to register your decision on the registry. Which leads to poll question number 3. How can you register on the Intent to Donate Registry? So your choices are to go to Access PEI, so that's where you would normally go to get your driver's license. The website, makeitZero.ca, your health card renewal form, or just mail in a form, a paper form. So the answer is actually all of the above. So everybody's right. The Access PEI, when we first started switching from the driver's license to the Intent to Donate Registry, we had the forms at all Access PEI sites, so that if someone asked, why isn't the question on my driver's license anymore, they could be given a registration form, a paper form. And we had also mailed out paper forms to, I think it was 60,000 people roughly, back in the fall of 2015. And whenever I did any public awareness events, I had the paper form with me. So that was how it started, was with the paper form. And then I think the health card renewal was next. So it became a question on your health card renewal and when you first applied for a health card. There's a question about organ and tissue donation on there. And then we were finally able to get it online. So now you can register anytime, online, anywhere, on your phone, your computer, laptop, tablet, wherever. And that is an advantage because before you could only register when you went to renew your driver's license or your health card, which was every 3 to 5 years. And if you wanted to change your mind in between times when you had to renew them, you had to get a new license. So this way you can change it anytime and it's available anytime. The information is available anytime. And all you need is your health card. For any of these methods, all you need is your health card. You need your number for your health card. So in the past, it was on the driver's license. As I said, you can kind of see, can I get my cursor going? There's the little red heart there. And on the back of your old health card, the orange health cards, there was a square, and if you put a sticker in there, that meant that you wanted to be an organ or tissue donor. So when I first started the job, for the first year, every time I did a public awareness thing, I would ask people, do you know if you're a donor or not? And people would say, oh, yes, it's on my driver's license. And they'd take their driver's license out and it wasn't there, or they couldn't find it, or they didn't think they were a donor, but there was a heart there. So people just had no idea whether they were a donor or not. And then I also had people who had the heart on their driver's license but no sticker on their health card, or vice versa. So then which one do you go by? So it was kind of confusing, and we thought it would be better to just have one way to do it instead of the two ways, and just to make it as easy as possible. So like I said, being able to do it anytime, anywhere, multiple different ways. Not everybody has a driver's license or voluntary ID, but everybody should have a health card. Every PEI resident. So the old ways are now officially gone. They stopped putting them on driver's licenses as of 2019, December of 2019. So nobody should have a heart on their driver's license. There are still people, I don't think the orange ones are in circulation anymore, but there are people who don't have the heart on the back of their card yet, just because it was a while before that part of the software was built in. It took, I think, 2 years or a year before they could get that added to the health card renewal form. So I forget when it started, but as of 2022, everybody should have had the chance to get a heart on the back of their health card. So I think I can't remember if health cards are renewed every 5 years or every 3 years, but by 2022, the end of 2022, everybody should have had the opportunity to register through their health card. So I should have had this as a poll question. I don't know why I didn't. Who can register to be an organ donor? So the answer to that is pretty simple. You have to be aged 16 or over. You have to have a valid PEI health card, because you need the number to register. And you have to understand what you are registering for. So according to the law, it says understand the consequences of your registration. And these are the only criteria that you have to meet to register your decision. There are no questions about age, medical conditions, what medications you're on, none of that. This is all you need to register to be an organ and tissue donor on PEI. So, if that's all you need to register, then why aren't there more donors? There are medical criteria that have to be met, and so that leads us to question number 4. So, which of these are reasons why people cannot become organ donors? They're over age 55, people with diabetes, people who are taking blood pressure medication, all of the above, or none of the above. None of the above. So 3/4 of you guessed that. That was really good. Or maybe you didn't guess, maybe you knew that. So none of those things are contraindications for organ donation. Any of the medical criteria would pertain to what is happening at the time of death. So when the opportunity to donate arises. So what are the circumstances around the donor's death? So the big 4 important things that absolutely everybody agrees on, these have to happen. The criteria to be an organ donor, you must be on life-sustaining therapy. So that could be a ventilator, mechanical ventilator, BiPAP, CPAP, different medications. You might need something for IV or whatever, but you're on something that is keeping your heart beating and keeping your organs oxygenated. Now, this kind of therapy is only available in the intensive care unit or the emergency department. So that means you would have to pass away in intensive care or the emergency department while you were on one of these life-sustaining therapies. So must be at the end of life. There's no chance for recovery at all. And you have to be stable. And I put that in quotes because obviously you're not going to be completely stable if you're on life-sustaining therapy. But if somebody is constantly going into cardiac arrest, or if they have to have their medications adjusted constantly, if they're just not doing well on life-sustaining therapy, then they probably aren't going to survive long enough to become a donor. So you have to be relatively stable as well. And you can't have any active cancer, so you can't have an active malignancy at the time of death or any serious infections. So the main reasons for that are that when somebody receives a transplant, they are put on anti-rejection drugs, and those drugs have a higher risk of causing cancer, put you at higher risk. So if we transplant cancer with an organ, there's a much higher chance that that person will develop cancer, the recipient. And serious infections would be things like if you're septic, if you have an infection in your blood, or if you have an infection and they don't know where it is, so they can't treat it, those would be serious infections that would mean you couldn't become a donor. And COVID is also another, relatively new infection that is on the list. And then there are other criteria, but those change. And so while these are absolute contraindications, the other things are more of a maybe. So they're called expanded criteria donors usually. And those things would depend on, the surgeon, the patient, the transplant center, a lot of different things. So that's why we say anyone could be a donor, because you don't know today if you're going to have any of these things happening at or around the time of your death, and you don't know what the criteria the transplant surgeon or transplant center are looking for. So things like hepatitis C and HIV used to be absolute contraindications, but both of those things are treatable now. So they're not absolute contraindications anymore. And the hepatitis C can be cured. And HIV positive patients are living long enough that they can be transplant recipients. So they will transplant HIV positive donor organs into HIV positive recipients because they have a life expectancy after transplant that's, not much worse than anybody else who doesn't have HIV. So, it just depends. And there could be other things in the future that they matter now, but they won't matter in the future because there'll be treatment. So every year I do a chart audit to see why people on PEI did not become organ donors. So I have data for the last 3.5 years, actually halfway through 2019. I haven't done 2020 yet. So they need life-sustaining therapy. So I look at everyone who died in intensive care or the emergency department. They're at the end of their life because they did die. And then I look for these medical reasons for why they couldn't become a donor. So for PEI, in that 3.5 year period, there were 407 deaths in ICU and the emerge department, and 388 of them were unsuitable to be donors because of medical criteria. So if you look at all of the people who die on PEI, there's roughly 100 a year who die in the intensive care and emerge departments, which is, a very small number. And then if you look at the people who have the medical exclusions, it knocks it down even more. So out of that 388 people, there were 19 who were medically able to be donors. And 11 of the families said no, that they did not want their loved one to be a donor. And in 8 of those cases, the patient was not referred to an organ donor organization. So the staff didn't make the referral. And if you'll notice, when I show you the reasons why donation didn't happen and what the exclusions were on the other slide, age was not on there. And as you get older, you get more likely to have different medical conditions or be on different medications, and those are not a factor either. So, which age group do you think had the largest number of organ donors? Which age group had the largest number of organ donors in Atlantic Canada in 2019? Do you think the largest number was less than or equal to 20 years old, between 21 and 50, between 51 and 60, or older than 60? So 20 to 50. Yes, you're right. So there were 41 organ donors in Atlantic Canada in 2019, and 14 of them were between the ages of 21 and 50. Very close behind that, with 12 donors, was the over 60 age group. So that might surprise some people. I have so many people who say, I want to be a donor, but I'm too old. Or I want to be a donor, but I'm on too many medications. So those things are not true. If you want to be a donor, sign up to be a donor, and we will figure it out when the time comes. And then the third highest age group was the 51 to 60 group with 11 donors, and the under 20 age group had 4 donors. So I think that's another sort of misconception that people have, is that it's younger people who become donors, when in fact it's pretty rare to have a younger donor. So kind of along the same line, what do you think was the most common cause of death for organ donors in Atlantic Canada in 2019? Do you think it was a stroke, which, for the sake of this, I'm saying a blood clot in the brain, a head injury caused by some sort of trauma, or suicide? Ooh, really even again. So stroke is actually the answer. Let me see. So stroke was 10, and subarachnoid hemorrhage, which would be bleeding in the brain, that was 6, and head injury was 6. And then there were a bunch of other different reasons, and suicide, there were actually none caused by suicide. So again, the big misconception is that it's young people in car accidents, or somebody who fell or was in a bike accident or something, but really the seatbelt laws, helmet laws, those kinds of things have really cut down on the number of deaths caused by those things. So question number 7, can islanders become donors? Yes or no? Yes, they most definitely can. I think what confuses people is that islanders can't become donors on PEI. The actual procedure does not happen here, but people from PEI can most definitely become donors. So, how many donors do you think have come from PEI in the last 10 years? 0, 7, 13, or 26? Oh, nobody guessed it. It's actually 13. We've had 13 organ donors in the 10-year period, which would be 2010 to 2019. So, as I said, the actual procedure does not happen here on PEI. So, this is sort of the general process that would happen. So, someone has a serious injury or illness. So, let's say, for example, they had a cardiac arrest, didn't get CPR, and so there was a lack of oxygen to the brain. They come in to emerge. They, shock them, bring them back, give them some medication, put them on a ventilator. So they're hooked up to all these machines and different medications and things. And they'll usually wait at least 24 hours to see if there's any sign of recovery in this person. So waited the 24 hours, it's a poor prognosis. So they'll do a discussion with the family about withdrawal of life-sustaining measures or life support. They'll talk to the family about this. And sometimes the family will say, let's wait another day or 2 days, or they might agree that their loved one probably won't recover, but they're waiting for family to come home or whatever. So I think what I want to point out the most is that this doesn't happen immediately. There is lots of time to be discussing this and thinking about it and making your decision. You shouldn't be rushed into making a decision. So after the decision is made to withdraw life support, the staff will consult with an organ donor organization. So we don't have an organ donor organization on PEI. We can call New Brunswick or Nova Scotia to see if they think that the donor would be medically suitable. And then they will check the intent to donate registry to find out what the patient's wishes are. So that way, when we go to talk to the family, we can tell them that their loved one can be a donor and that we've checked the registry and their loved one would like to be a donor. Now, the staff may also call the organ donor organization and check the registry before they have the end of life discussion with the family. It doesn't mean that that person is going to be an organ donor. It just means that they want to have the information in case the family asks a question about donation. But generally speaking, the discussion about withdrawal of life-sustaining measures should be separate from the discussion about organ donation. So then if the family agrees, the organ donor coordinator will contact the family by phone, explain the process, get consent, get a medical and social history. The donor will be transferred to the organ donor organization either in Nova Scotia or in New Brunswick. The family can say goodbye on PEI or they can travel to the donor hospital. The donor will be transported by air or by ambulance, and the family can go if they wish, but they have to travel in their own vehicle. So some families will choose to just stay on PEI, and other families prefer to be with their loved one. Once the donor gets over to Halifax or Nova Scotia or to Moncton, donor testing is done to ensure the health of the organs. There's matching with recipients, coordinating the recovery, and that can take 2 to 3 days. So again, you have lots of time to think about this, talk about this, change your mind, discuss it with loved ones, and you can change your mind right up until the last minute. If you get over there and decide this is just too much, you can stop and say that you don't want your loved one to do this. The organs will be recovered and transported to the recipients, and they will be transplanted where the recipient is. And then the donor is sent back to PEI to the funeral home that the family has chosen. So the organ donor coordinator will keep the family updated as much or as little as they want. If the family wants to stay on PEI and they just want to know when it happened, like when the surgery happened, and that's all they want to know, then that's all they will be told. But other people want to be updated regularly. So it's as much or as little as you want. All right, that's it. I'm sorry that took so long. I wasn't planning on talking that much. So if you have any other questions, or if you're watching this after the fact, you can email me at adcarpenter@ihis.org. You can leave a message at 902-368-5920. You can also go to makeitzero.ca for more information. That's our website. And you can follow Organ and Tissue Donation PEI on Facebook.
Thank you so much, Angela. That was really great, and I really liked the photo in the story of Debbie that you shared in the beginning. It's so true that organ donation affects so many more people than just the recipient. And it was also great to hear that the second highest age group to donate organs was above 60 years old, because as you said, it is a misconception that you have to be young or only young people can be organ donors. So, and especially with the different health conditions too, that was really great to clarify. So we do have some questions that I'll get to.
Okay.
So is it possible to donate organs if you have been treated for cancer in your lifetime? I know you said that if you have active cancer that you can't donate, but what if you've had cancer in the past and it's been treated?
So that's one of those maybe situations. So it kind of depends what type of cancer you had, how long ago it was, how far it had spread, what the treatment was, if you've kept up with all of your rechecks after your treatment is done so that they know that you are cancer-free at the time of death, then yeah, we would make the referral for sure.
So you can definitely be request to be put on that list on
Definitely,
the Intent to
yes.
Donate registry. Cool. And what if you're under 16? Can you donate your organs if you're under 16?
You can. You can't register on the registry if you're under 16. And you can't register on behalf of someone else. So there were the three criteria that you have to be, two criteria really. You have to be 16 or over, and you have to understand the nature and consequences. So if you fall into one of those two categories where you don't have the capacity to understand, or you're under 16, I couldn't register on your behalf ahead of time. But if the opportunity arose, then we would go to their next of kin or substitute decision maker and ask for their permission.
So that kind of brings us to another question. Somebody's asking if it's true that their family has the final say, and I think they mean that can your family say no to donating your organs even if you've registered as yes on the Intent to Donate registry?
So yes, in practice, we do leave it up to the families. So that is why it is really, really important to talk to your family about your wishes and let them know what you want and why this is important to you, and that you do understand what this means, what the consequences are. Families are much, much more likely to agree with your decision if they know it ahead of time. But we always like to give the family that chance to say, like we will say, we check the registry, your loved one indicated that they don't want to be a donor, but we just wanted to check with you and see if they might have changed their mind.
Mhm.
And vice versa. We checked the registry. Your loved one said that they did want to be a donor. Do you have any reason to think they might have changed their mind?
Right. And I think that's a really good point. Talking to your family about it. I think a lot of people think it's kind of a topic that they don't want to bring up, or might be uncomfortable to bring up, or might think that they're making their family members uncomfortable. But I think it's something that we really do have to talk about more, and talk to your family about it, because you're right. I Families would be more likely to honor your wishes if you did have a conversation with them beforehand. So
Yeah.
that's a really good point.
And it can be really overwhelming to ask a family that at
Right.
the time. So you've just been told that your loved one isn't going to make it,
Mm-hmm.
and they're asking you to make this decision to transport your loved one to another province, to, have this surgery and undergo these tests. And, if you're really overwhelmed and upset, it's hard to make that decision,
Mm-hmm.
but it's easy to confirm that yes, this is what my loved one wanted. We talked about this, and I know that this is what they would have wanted.
Exactly. It can kind of take a little pressure off your family in that moment if you do talk to them about it before.
Right.
Yeah, that's a really good point. We have a question about around COVID-19, and how, like, has this affected the process of organ donation, and how has that affected it?
So, as I said, you have to be in intensive care or the emergency department. And usually, even if you're put on the ventilator in the emergency department, at some point you will be transferred to intensive care. And at the moment, in a lot of provinces, the intensive care beds are full of COVID patients. So there's no room for new patients, like for donors, but also we don't want the transplant recipients in the ICU with COVID positive patients, because after the transplant, usually the recipient will have to be in ICU for at least a short period of time, at least a day or so. So yeah, it's a huge risk. Um, there is no cure for COVID at the moment, and people can get very, very sick. So we don't want to expose anybody to that if we don't have to. And in some provinces, the organ donor coordinators who would normally be doing all of this work have been redeployed to the intensive care. So there isn't actually anyone to do the organ donor coordinating, even if they did have the bed. So, yeah, it has had a huge impact on organ donation in Canada and around the world.
Yeah, another good reason to make sure that we're practicing safe social distancing.
Yes, yes.
Yes. Yeah, listening to our provinces is it's a really good point.
Yeah, it's scary.
It is. It is. You did mention that, I think, towards the beginning of the presentation, that there's transplants for science, or organ donation for science or transplant. So can you choose which one, or how does that work?
Yes, you can choose which one. So I'm I'm not aware of being able to choose ahead of time for certain organs other than the brain. The Alzheimer's Society does do research on brains, so you can donate your brain after death. And then you can donate your body to science as well. So it's the whole body. I'm like I say, I'm not aware of being able to say I want to donate my heart to something. So those are the only two things that I know of here on PEI.
And what if you think you're an organ donor but not positive? Like, if it's not on your health card, but maybe you didn't register before you got a new health card, or like, how does that work?
So if you have a heart on the back of your health card, you are definitely a yes on the registry. If you don't have the heart, it could be that you said no or you're just not on the registry. Or it could be, like I said, you're kind of in that gray area where it hadn't quite switched over yet. So the only way that you would probably know for sure is to call me
Okay.
and give me your health card number, and I can look you up and tell you
Okay.
if you're on there or not and what your answer was.
Perfect. And I'm just going to add your information in the chat box. There. Perfect. And just another question. Um, Somebody's asking about if they can choose who the organs go to. So if one of so if they know somebody on a transplant list and their family members want to donate their organs when they die, can they choose who it goes to, or is it just like random?
No, it would just be random. So if you're a living donor and want to donate a kidney or part of your liver, then yes, you can say who you want it to go to for sure. But if you're a donor after death, you can't. You would just go on the the list and they would choose the best match for you out of the people who are waiting. And we have had that situation a couple of times. In one case, there was a family member who needed a cornea transplant. So they wanted to know if the person who had died could donate their corneas to that person specifically. And we weren't able to do that. And in another case, it was somebody waiting for a kidney, I think. They knew someone. It wasn't a family member, but they knew someone.
Okay.
And that couldn't happen either.
So there's one, like, you hear of some people who, the doctor said there's a low chance of them surviving from whatever happened to them, but then they did end up surviving. What would happen to those people if they had become organ donors?
So this is kind of morbid, but there is something called the dead donor rule. So the organ donation itself cannot cause death or lead to death. So, if you take somebody's heart out, they're going to die. If you take somebody's liver out, they might not die right then, but they will die eventually. So that removal caused their death down the road. So that cannot happen. So there are many, many, many safeguards in place to make sure that the donor is definitely deceased at the time of donation, because nobody wants that to happen.
Okay, that's comforting. Thank you.
So even
A little morbid, but definitely comforting.
and there are times that a doctor will go to the family and say, we don't think your loved one is going to make it. And they might call the organ donor coordinators. But if the donor doesn't meet the criteria, like I said, all of those steps that they have to go through, they won't be a donor. They just won't. So those people would have been fine. They would not have been donors.
I think it is interesting, though. You mentioned at one point it's, always if you want to become a donor, you're not sure if you can or whatever that might be, register as yes, because you don't necessarily know what condition or, what your condition is at that time. So it's good to always, if you want to be, then to register as yes, because you just don't know and you might be able to.
That's right. And hopefully we're all going to be around for a while. I plan on being around for a long time. I have registered to be a donor. I have no idea what the next, 40 years are going to bring as far as my own health or as far as scientific and medical advances. So really, it's just a question of do you or don't you? Do you want to?
So would you say it's true that, it's never too late to donate or never too late to register?
No, you can change your mind at any time. And we do have people who have registered multiple times.
Okay,
So,
interesting.
and each of those only counts as one registration. So when I say that there are 60,000 people on the list,
Mhm.
those are 60,000 separate, like
Okay,
one person for each. Even though you've registered 10 times, it only counts the
right,
last. And
right.
they also remove anybody who dies is removed from the list as well. So that
Okay.
60,000 is 60,000 eligible people.
So it's a really true representation of the amount of people. Well, thank you very much. We've had lots of questions. It was great that we were able to get to them. If you have any questions after this, or if you're watching this through a recording, you can message either myself or Angela. I put the information in the chat, or Angela also had her information at the end of that presentation. My email is atlantic.programs@kidney.ca. And Angela, your email is?
D as in donor, Carpenter at ihis.org.
All right, perfect. And those emails are in the chat box as well. So I'll just remind you that this is being recorded. So in a few days' time, you'll get an email from myself, and I will include the recording of this and also Angela's slideshow, so you can see that as well. And I will include a little survey at the end just for you guys to fill out. It only takes a few minutes, and it lets us be able to provide more of these types of webinars. So thank you so much, Angela. Do you have any final words?
Uh, just register to be a donor and talk to your family.
Exactly. I think that's a big one. Talk to your
Yes.
family.
Yeah.
That's a big one. Well, thank you so much, Angela. This was really, really great. I hope that we can have you again sometime.
Okay. Thank you very much for inviting me. It was great.
Thank, thank you. Bye,
Bye.
guys.